My name is Phillip. I'm a clinical psychologist here at the Road Home program. I work both as part of the intensive outpatient program as well as the outpatient program. I'm treating clients, and I'm also the assistant research director for the program. What I'd like to talk about is cognitive processing therapy, and the easiest way to talk about it is by explaining really what it is intended to do. So when we experience traumatic or stressful events, one of the things that we as human beings tend to do is we try to make meaning of what happened to us. So we try to make sense of it in some way that we can. So imagine something bad or horrific happens. How would you interpret the situation that happened to you? And depending on how we interpret the situation really determines how we end up feeling about it. So if we evaluate it in a relatively negative light, one of the things that happens is we tend to develop more negative emotions such as anger, sadness, shame, guilt, or fear. One of the things that happens when we have a relatively balanced view of a situation is that these emotions might still be there, but they may not be as intense as they were before. And so what we're trying to do as part of CPT is we're trying to evaluate how are we thinking about certain situations. So common beliefs that create these negative emotions are ones where we believe that we should have acted in a different way. So for example, we may believe that we should have seen the IED before it went off, or that we shouldn't have pulled the trigger. In other situations, we may believe that there was something that we could have definitely done to prevent a sexual assault from happening. And through cognitive processing therapy, or CPT, we begin to identify these beliefs that are driving our distress, or especially our emotional distress, and that prevent us from functioning. And what we then do is we evaluate whether there are ways in which we can interpret the same situation, but look at them from a different perspective so that maybe the meaning changes slightly. And oftentimes what we find is that we ignored important aspects of the situation simply because we were so focused on a single key event. And what we learn from looking at the situation in different lights is really that the same situation can be interpreted from many different angles. And each interpretation then leads us to think about the situation differently and also feel about the situation slightly differently. While this can seem very daunting, that's really what the CPT therapist is for. The therapist will ask sometimes challenging questions that will help you develop a new perspective of an event that you have previously experienced and that you have made meaning of. And through this process, what you will learn is that maybe there are different angles from which you can look at this situation. CPT has been shown from research that it reduces PTSD as well as depression severity in individuals who complete the protocol, and the protocol length varies between 12 and 16 sessions. Sometimes the protocol can be even completed a little bit sooner depending on the progress you're making. And one of the things to keep in mind is all the skills that are taught as part of CPT are ones that you can use following the treatment. So once you're done, our goal is to make you your own CPT therapist. And even though this process can seem relatively daunting, again, research has shown that it is effective, and we know that we will do our best to help you learn all of these skills that it takes to get better and to improve from your PTSD. In other words, what we're hoping to do is to get you unstuck from those negative beliefs that keep you in this negative cycle and prevent you from recovering from PTSD. And even though it seems challenging, my hope and encouragement to you is that you give CPT a shot. Join us here at the Road Home program. Complete a course of CPT and then evaluate how you're feeling to see if we can help you in any other ways as well.